Hello, everyone. Thank you for joining us. My name is Nerea Hoft. I am the Senior Communications Associate at the W. Edwards Deming Institute, and I am here to welcome you to Out of the Crisis, How to Use Control Charts to Fight COVID-19, Session 2. Today is Thursday, May 21st, and this is a repeat session of the webinar we had on this same topic just 1 week ago, but with a few improvements and new information here and there. We are thrilled to have with us today Kevin Edwards Cahill, who is Dr. Deming's grandson and also the Executive Director at the Deming Institute, as well as the esteemed Balaji Reddie, who sits on our Advisory Council, and who is also, of course, the founder of the Deming Forum India. Welcome, Kevin and Balaji.
Morning.
Before we begin, we're just going to take a few moments to go over some logistics. This webinar will last 1 hour. We are holding about 20 minutes at the end for your questions. After the webinar, a very brief 4-question survey will pop up on your screen, and we would really appreciate your feedback so that we can improve. You probably noticed that you are muted. That doesn't mean that we don't want to hear from you. So if you have a question, please type it into the questions box in your GoToWebinar control panel. Note that only the organizers will be able to see your question. So if you want to communicate with the audience, then you would use the chat box. And if you experience any technical difficulties, please send us a question or call GoToWebinar at their toll-free number. Also, we are recording today's webinar, and we will send you a link of the recording shortly. We would also like to let you know about our upcoming events and resources, which you can find on our website. Again, we'll be sharing the link to the recording of today's webinar with you probably sometime today. So if you have a colleague or a friend who you think should watch today's session, please do share the recording. You will also receive a link to some other related resources in a follow-up email within a few days. And if after today's session you're ready to dig deeper into Deming, the Institute is co-hosting a 2.5-day seminar that will take place in a series of virtual sessions starting in June. You can register online at deming.org/events. And we also offer a wealth of free resources, so please check out our Deming podcast and blog. And we're also planning on launching a new online learning platform this fall. So now I would like to turn things over to our Executive Director, Kevin Cahill, to say just a few words about the Deming Institute. Kevin, thank you so much for joining us today.
Hello, everyone. Welcome to our second ever Deming Institute webinar. A number of years ago, Balaji and I had a phone call where I learned of his respect, his study, his tremendous desire to teach and spread my grandfather's philosophy. That led to many more Skype calls, and Balaji eventually joining the Deming Institute Advisory Council and becoming one of our keynote speakers at the 25th anniversary conference in 2018. I believe, Balaji, it was 2002 when you first presented at a Deming Institute event in New York City at the Deming Institute Research Forum. So it's been a long relationship. Since then, Balaji has worked with us on a number of projects. And when our team members were discussing one of them last month, he told us about some of the exciting work that he's going to discuss with us today. We quickly understood in this COVID world the value of this work and spreading this understanding and awareness. After working with our Deming Institute team members, we conceived this webinar with Balaji graciously leading it. Because it was oversubscribed to the last time, we ended up having the second one there. For those of you who don't know Balaji, let me tell you a little bit about him and then we can get started. Balaji Reddie is the founder of the Deming Forum India, as Nerea mentioned, and was recently honored by the National Center for Quality Management for 20 years of contribution to the field of quality in India. An engineer by trade, Balaji became interested in the Deming philosophy after a chance introduction to the founder of the British Deming Association, Dr. Henry R. Neve, who many of you probably know on this call, and he became Balaji's mentor. Since then, he's introduced thousands of my grandfather's teachings, including presenting papers for private and public audiences, and serving for 10 years as an adjunct professor in management colleges with a focus on production, operations, and supply chains. He's currently employed with an educational group, the Sri Balaji Society, in his hometown of Pune, India. So without further ado, Balaji, take it away. We're excited to have you back for a second webinar.
Well, thank you so much, Kevin. I mean, I said this last time, and I'm saying it again. I would not have dreamt that this would happen maybe 15, 20 years ago. If somebody told me that Kevin Cahill is going to introduce me at a webinar, I would have said, please take a walk. But well, that's life. You never stop dreaming, do you? Well, coming to our webinar today, okay, just making a point clear before we begin, this is aimed at both the beginner and the connoisseur. It's talking about control charts, one of the most amazing graphical representations invented by Walter Shewhart. And just for our audience who are new today, I mean, the ones who were there last week, if they are getting over today itself, well, they're going to see this again. But the control chart was invented by Walter Shewhart on May the 16th, 1924. So the control chart now is 96 years old. And when he conceived it, I don't know whether he really felt or he knew or he would ever have imagined that this would be so widely used, because he changed the very concept of quality, a new birth, so to say, of it as a management science. It was only considered to be something like glorified inspection, but control charts changed everything. It created the quality profession the way we know it today. When Walter Shewhart conceived that, I remember Dr. Chiron saying this, that people thought that he was from another planet. They never really understood the power of this. But I think W. Edwards Deming was the one who really understood this very well. And the rest, as they say, is history. So if it was the only, well, I hate to use this word, tool that W. Edwards Deming ever spoke of in his 4-day seminars, it would be the control chart. But he said it's a different look at processes. All right. In fact, in 2001, it was Don Wheeler, one of W. Edwards Deming's students, who suggested that we should rename the control chart, because he christened it as the control chart, well, because he wanted to understand a process. And there was too much of chaos reigning at that time. People had no idea how to look at a process, and he gave us that direction. So Don Wheeler suggested the term system performance, or rather process behavior charts, PBC, process behavior charts. But then that meant that SPC from statistical process control would become system performance charting. So these were the terms that were, well, floating in the early 2000s, but I don't think they ever got down to being official. Though sometimes I see some people quote that, and I quote it. I call it as a process behavior chart and system performance charting. So for those who've been introduced to control charts before, fine, this would just be kind of a go back to the roots bit. A control chart typically, all right, has 4 lines that exist on it, okay? And these 4 lines are called as the upper control limit, the lower control limit, the average line, and then the actual performance of the process, which are depicted through points over a period of time. One of the most powerful things about the control chart is it is a time series diagram. It's a time series illustration, and it tells us how a big process is behaving over time. The key to that, okay, are the control limits. When Walter Shewhart conceived this, he said as long as a process is fluctuating randomly within the limits, between the limits, then it's a stable, controllable, predictable process. All right, you can predict what's going to happen. You can say that it's fine. That's the way the process is. It fluctuates within those limits because of its inherent properties. So he called it as random variation, this variation that exists between the limits. W. Edwards Deming, of course, coined a different term for that. I'll come to that a little later, but he called it random variation. And he said as long as the process is fluctuating here, That's the way the process is. Because of the way it's been built, it's designed, the way it's being used, that's the way it is. It's going to be that way. You want to change it, you've got to change something fundamental in it. But when it crosses the limits, all right, that is when something other than normal has happened. It's an abnormal variation. So he said that that's normal variation. He called it as random variation or random cause variation, because they're not one cause. There'd be a host of causes that are working together to make these points fluctuate randomly within limits. But when it crosses the limits on either side, either above or below, then something other than normal has happened, abnormal variation. And this would be not a huge system of causes. It would be just one cause, which does not belong to the system. So how does that help us? Well, Walter Shewhart said, when you construct this chart and you see the points within limits, well, that's the way the process is. Don't really break your head or trying to find out the reason for the random points going up and down and randomly fluctuating. Don't do that, all right? But when it crosses limits, stop and ask the question, what happened here? And you will find a particular reason. Whereas when it's within limits, you'll find a host of reasons, right? So that out of control, now whether it's on the higher side or the lower side, something special has happened. If it's on the higher side and going up is bad, then we need to eliminate that particular point. But if going up is good, we need to make that a part of the system. Likewise, if you go below the lower control limit, the same kind of explanation that I can provide here, that look out for a cause. It'll be a particular cause. You can find it, you can make it a part of the system or eliminate it depending on what you're looking at, all right? So the term used by Walter Shewhart was assignable cause, because you could assign a cause to that point outside the limit, but within limits, it's random. Now, around the 1940s, now this was in 1924 when he came up with these terms, but in 1940s, W. Edwards Deming coined the terms common cause and special cause. So when the process is fluctuating within limits randomly, he called it as common cause variation. When it's outside limits, it's called special cause variation. All right. You also have someone like Joseph Chiron who called it as chronic variation and sporadic variation. But later on in his own handbook, the Quality Control Handbook, he said very clearly that I'm resorting to using W. Edwards Deming's terms throughout the handbook. So he also used the term common and special cause, and that has remained. All right. Now, the point here is, how do we use these charts? And I've seen some people draw control charts because, well, they can draw a control chart. That's not the way to do it. You need to understand that we need to see why we are doing something. So you want to understand a process better. And if you're faced with something that's where the data is just staring at you and you don't know what to make of it, I think the best way to then look at it is arrange it according to a chronological sequence, a function of time, and then draw this graph. Believe me, you'll see things differently. I'll just take a couple of examples to illustrate this. A simple one is a control chart that I drew for the time taken for me to get from home to work every day. Now, for those of who here on the webinar today who are my students, I think they know this entire table and this chart by heart. But let's take a look at this. It says here, this was, of course, drawn by me around 13 years ago. It says here, now here in India, we of course write the date first and the month later. So you can see 1st of August and 2nd of August. So this was done for 10 data points. And it says it took me 19 minutes and 22 minutes and so on and so forth. Now, if you look at the numbers only, I'd like you to look at the numbers. Forget the second row, they say ranges. I'll come to that a little later. This is the time taken. If I were to ask you what's the maximum time I'm going to take to get to college, and you look at that and say 23 minutes, and how quickly can I get to college, and you'll say 15 minutes. But now let's see how the control chart gives us a different kind of an insight. So the first thing we do here is we calculate the average. Well, that's pretty easy to do. You add up all of that, the minutes, and divide by 10, since there are 10 observations, and you get 18.7 minutes. But now we are going to find out what is called as a moving range. Now, this chart we're going to be constructing is called as an XMR chart. All right. The moving ranges, you can see there that we subtract the second data point from the first data point, and we only write down the difference and not the sign. Right. So there the ranges, and then we divide them by 9 because they're one less. And then we put them into a formula there, and you can see here that we get 18.7 as the average, and the average of the ranges as 3.22. And there you can see when we substitute, you get the upper control limit as 27.7 minutes and the lower control limit as 10. None of these numbers appear in the data points there. Fabulous. You would have never even guessed as to what the limits could be, but that's the beauty of the control chart. Now, when we plot the graph, here's what we get, right? Now, here you can see that the upper control limit stands at 27, the lower control limit stands at 10, the average is 18.7 minutes. Now let's interpret this. This gets really interesting. It takes on an average 19 minutes or 18.7 minutes for me to get from home to college every day, which is just about, well, the time that I do. But this is when I leave my home at 8 o'clock in the morning. But the upper control limit tells you the maximum time that I can take to get from home to college, which is 27 minutes. And the lower control limit is the lowest time I can ever take to get to college if I leave at 8 o'clock, and that's around 10 minutes. Now, this is insightful because this is at 8 o'clock in the morning. Given the fact that I'm going to be taking the same route every day, I drive the same car every day, I drive in the same manner every day, the conditions of traffic at that point in time, well, this is what you get. If I leave my home at 8:05, well, then the average time remains the same, but the limits get a little wider because one of the common causes has changed, and that's traffic. The traffic would increase a little more at 8:05. At 8:10, the average slightly rises, right? And the limits get a little further away. But at 8:15, the average goes up significantly. And then the upper control limit reaches 45 minutes. Now, what do we interpret here? That if I leave my home at 8:15, my college commences, the first lecture commences at 9 o'clock. So there's a good chance I will not reach my class for the first lecture on time at 9 o'clock. And so I leave my house at 8 o'clock and I'm in the college premises by around 8:20, and I'm parking the car over there. The maximum time I'm going to take is around 8:30. And believe me, in all these 13, 14 years, okay, that's the way it has been. And all my students who are here will vouch for that. They've been witness to all of this. They can bear testimony to this. There have been instances when I've reached late, but there were three instances, have been special causes. There was something other than normal that happened, but by and large, it would take me within these limits to reach college, right? There are three cases I can actually remember them. Obviously, it's so vivid because they're just three cases in 13 years, which means this really has worked. Walter Schuhart, you were a genius. All right. Now, the first case I remember was there was an accident on the road, and so there was a huge holdup, and we really got delayed, not just me, but everybody else. And so I remember calling up college and saying that I'm going to be late, the academic department, and then he said, "Don't worry, there are many people stuck behind you in the entire traffic jam. So we're starting college 10 minutes later than normal." The second was when my car broke down and I had to take public transport to get to college, and that I reached a little late. The third case that took place, now these two cases happened within a matter of 2 or 3 years, but the third case that took place was quite interesting. It happened around, I think, 4 years ago, 2 to 3 years ago. This was by my students. Okay, this was I remember the specialization batch. There are different specializations in our college, and this is the operations specialization batch. And these boys, they're amazing, but they showed their naughtiness that day. I remember by this time, of course, we had WhatsApp and what have you. So I contacted them and I said, "Hey, I'm going to get late in class because there's been a horrible jam here. And you guys just remain in class and continue from where we left off yesterday. I'll come in late." And so I walked in at 9:10 when I was free from the jam. And I was in such a tearing hurry to set up that I didn't even look at what these naughty boys had done. When I set up and then I looked at them and they had that naughty grin on their face. And then I turned around and looked at the board, and these boys on the whiteboard had drawn a control chart with a third point outside the limit, saying that the third time you've come late. But that's how powerful this can get. So my advice, okay, the takeaway from this, don't manage by the average, manage by the limits. Now, I'd like to share another case here, okay, of the control chart being used in the field of, well, this is, time taken for me to get from home to college. People have used it in manufacturing. oh, there's just endless uses. But this is in the field of healthcare. Now, this is a hypertensive patient. By the way, this is Dr. Henry Neve, who was diagnosed with high blood pressure. And well, that's a symptom, but he was looking at taking beta blockers, and he was tracking his pulse rating. And you can see here the trend upward, and it's crossed the upper limit and gone up. And then that's when he visited the doctor, and the doctor gave him a beta blocker to control the blood pressure. So you can see he took beta blocker 1, and well, the beta blocker is supposed to reduce the blood pressure, but when he took that, it didn't really reduce it, it regulated it, which means it was oscillating, but staying about the same. And when he went back to the doctor asked him, how are you feeling now? And he said, well, I feel okay, but it's not really brought down the pressure. He said, what do you mean? It's just you're just imagining things. I said, no, take a look at this. And then he showed him the data and the oscillation. And that's when the doctor suggested a second beta blocker to be used in place of beta blocker 1. And that's when the blood pressure came down. And you can see that ever since he's been taking this beta blocker for the last, well, whatever, 15, 20 years or whatever. Okay, and it's been under control. By the way, even when I met Dr. Chiron, he had drawn control charts for his blood pressure, his sugar levels, his pulse rate, and he lived to the age of 103. And he of course passed away, of course, due to natural causes, and didn't have any kind of ailment. All right, so control charts work, and they work in something as vague as healthcare. I mean, vague in the sense that you can't predict it, but you can control it in some way. All right, but now let's take a look at COVID-19, because that's what we're faced with right now. Now, when the whole world was faced with this pandemic, all right, the first question, right, that struck me, okay, which is the theme of this particular webinar: can we use a control chart for trends in an epidemic? Well, let's hear it from the man himself. This was in Japan in 1950, when W. Edwards Deming gave his now path-breaking lectures. And this is towards the end of the lectures, the 8-day program that he took there, and he was trying to motivate the Japanese scientists and engineers and management that you could use this anywhere. And here's what he said. He says here that a doctor divided the San Francisco area into districts of 50,000 people because he used this as a method for studying disease. And he found that in some districts there was a distinctly higher incidence. He used what is called as a C chart. Now here you divide this into equal samples, and that's when he used this. And then he found that there were some points that were out of control. And that's where he said some districts, the incidence of disease were higher because the water mains were polluted. Well, you can read that further, but this comes from his book, The Elemental Principles of the Statistical Control of Quality. Well, here it is, the little red book, right, from where this has been taken, and we just scanned and put it up for you. So, well, it can be used in an epidemic, all right? So this was rankling in my mind, of course, and then came when this pandemic struck the whole world, okay? We, of course, were affected by this a little later, all right? So our first case in India was, I think, Jan the 31st when we recorded our first ever case. But the real spurt that came in post mid-Feb. Okay, this was after President Donald Trump visited India and went back. Of course, this has nothing to do with his visit. But what happened after that was a number of cases started, but they started not spiking, they started rising. And by March, okay, by March 11th, that is when March 12th, when WHO declared this as a pandemic. Now, when that happened, obviously, there was panic buttons pressed all over the country. And by March 24th, our Prime Minister announced the lockdown. He said, we're going to just shut down India. We're going to see to it that we don't spread this much, because we got a population that's 3 times the size of 3 times the number of the United States, and we got our country's 1/3 the size of the United States. And if this enters here, it will just spread like wildfire. So we need to control it. So we went into lockdown. Now that's when people started, news channels started reporting things on a daily basis. Tests were being conducted, and the number of positive cases was being reported every day. And I saw there were panic buttons being pressed in the media. look at the number of cases. And they were typically showing a bar graph. And you can see here, let me be honest with you, till around, I think, 3rd or 4th of April, I never really looked at drawing a control chart for these. But here's what happened. They showed the numbers rising. And I said, wait a minute, they're showing the absolute number of positive cases, when they should be telling us how many people have been tested and what percentage of those have been found positive. If the rate of cases being positive every day is pretty constant, then we don't really have to worry. I mean, we don't want this. Let's make this very clear. But we don't have to panic. Let me put it that way. We really don't have to panic. We need to learn how to keep our heads just cool and deal with it. Okay, because that's the way the process is. It's predictable. If you can predict it, you can say, okay, it's not spun out of control. As we can say, I don't know what's going to happen tomorrow types. All right. But this was not then. And that's when I started digging deep and getting all my data together. When I put all my data together, I discovered that up until 27th of March, all the tests were being conducted by only government laboratories, and they were conducting maybe 500 to 1,000 tests per day. But 27th March onwards, it became 4,000 to 5,000 tests per day. And then it got ramped up every single day to 8,000 and 9,000. By mid-April, it was really, really high, all right, for us. I mean, we started doing this, but the media kept on reporting only the number of cases. Now, that's when I drew the control chart. When I drew the control chart, what happened was this. I anticipated this. Let me tell you why, okay? Now, there was a particular incident that took place on the 31st of March and 1st of April. I don't want to get into what that case was, all right? But I said, if I draw a control chart and if all of the percentage of positive cases lie within limits, and if the control chart can identify this spike, well, then we can say that the process is predictable, right? And this is exactly what the control chart showed me. Now let's take a look at this. The lower control limit is 0. I'd like you to take a look at the average, which is around 6.12%. That means 6% of the tests carried out were resulting in positive cases. And this was, like I said, from 27th of March onwards, it became 4,000 to 5,000 cases. 1st, 2nd, 3rd April onwards, it became 4,000, 5,000 cases every day, tests every day. But here's the one spike, all right? Now, I said, okay, now this was a real special case. Under normal circumstances, when you're in a company and you're faced with a control chart like this and you see a spike like this, you find out the reason. But this is not a process, so to say. So here's what I did. I decided to ignore that and see how the control chart looks. Now, we don't do that normally in a process. Actually, if you were to be doing this in a company, you'd say, what's the reason for that? And you find the reason for that and eliminate it. Don't remove the point and do this. I did this for a reason. So here's what I got when I removed that one unusual spike. You can see that the 1st of April is missing from the x-axis and the dates, but the average dropped down to 4.67 and the upper control limit was 14.04. If you saw there, it was 22 points. And here, of course, the lower control limit, it remains as 0. But it told me that the process was within limits. The average came down and everything is okay because I removed that one spike. Now, when I looked at this, I said, why are the media creating such a big hullabaloo over this? And this was, you can see, the date of 8th and 9th of April. Now, I said, I need to reach out to someone and show them this, all right? So there was this gentleman I had met, actually, when I wanted to do a course in quality management. This was a Master of Science in Quality Management at the Indian Institute of Quality Management at a place in India called Jaipur. And the director of this course was a gentleman, Dr. Giridhar Gyani. So I phoned him up and I spoke to him on the telephone saying, I want to do this course. And he said, send me your resume. So when I sent it over, he asked me to call back. And when I called back, he said, you shouldn't be doing this course. You should be teaching the course. And I don't know what got into my head. I decided, oh my God, am I so good? So I'm not going to do the course. But eventually, I had to go back later and complete the course. But nevertheless, that's when we met. I mean, we spoke for the first time. We hadn't met in person. I met him in person in 2004. So this conversation took place around 2001. In 2004, between 2001 and 2004, we had sporadic phone calls, but we never got down to really having a kind of a conversation over the long run. But 2004, I gave my first program for Indian Railways. There was a gentleman, Arvind Mathur, who called me in, and he told me to take a couple of sessions for the railway staff. Okay, and that's where Dr. Girdhar Gyani was. And he heard me speak. And then during the lunch break, he came and said, I think I have some work for you. Why don't you keep in touch? And he gave me his mobile number. And ever since we've had this thing going, he's now, of course, the director of the Association of Healthcare Professionals of India. And he keeps recommending my name to colleges and institutes that teach healthcare. And I have gone and given these guest lectures on quality management in healthcare and, well, lean in healthcare. And of course, I always give it a Deming twist, whatever I teach. But nevertheless, so we've been in touch. So when I was reading the newspapers, I saw that his name come up, and I said that, and I saw that he was part of the COVID-19 task force that was set up by the Prime Minister. So I got on the phone, okay, and I thought, let me give him a call. But I said, no, wait, let me send him these graphs. So I sent him these control charts and with the data. And since he was someone associated with quality, I thought he'd get it up right. And then I sent him a mail, and then I sent him a message on WhatsApp. And I said, could you please look at your mail? I've sent you something. And a day later, he sent me a message. He said, give me a call and we need to talk. And he said, what is this you've done? This is phenomenal, but could you please explain to me what has happened? And I told him that, look, doctor, the media is making a big mess out of this. They're trying to claim that the lockdown is not working because they're reporting only the number of cases, but they're not reporting the percentage of cases. And if the percentage of cases is pretty steady, then the lockdown is working. It's predictable. It's manageable. It's not something that has spun out of control. And then I showed him the graph with the spike and without the spike, and I gave him the explanation, and he said, phenomenal. He said, why don't you do one thing? Because I'm having a meeting with, the COVID-19 task force is meeting tomorrow night with the Prime Minister. I will show him this. I'll show the team, and then let's see what we can do about this. All right. And so I wrote out my first report and I mailed it out to him. And when he ended that conversation with me, a teleconversation, he ended by saying, Balaji, good work. Now that was very, very encouraging on his part and very sweet of him to say that. But moving ahead, all right, when these control charts reached, then he called up the next day and he said, this was phenomenal. They love what you've done. Why don't you draw control charts for the rate of fatalities and the rate of recoveries also? I said, okay. I was just going to do it for the positive cases. But as I kept doing that, things started changing. Now, when I showed you the previous graph, the upper limit was 22, the average was around 6.12, and the lower limit was 0. But when I removed the spike, it came to this. But as I kept drawing this, okay, you can see what happened next, right? Now, this went on for another, say, week or so. 10 days later, when I drew and presented the next graph, well, take a look at this. The average hasn't changed much. It's almost the same. But what has happened to the limits? Where the limits have come closer to the average, barring that one spike. But that is spike which was a rollover for the previous month. If you go back and check, then that point was outside limits there because that was close to 14, whereas now it's come down to 7.68. But what does this indicate to you? It indicates that the control limits have come narrow, which means things are getting a little more, well, predictable. It's manageable. It's not something we need to, get very anxious about. And see, this is the whole month of April, and by this time the testing had ramped up to close to 30,000 per day. All right, and still you can see that the average was pretty okay. It's 4.68, 7.6, and 1.6, which means it's way within limits. In fact, the trend is a little downward. And now, if you see, as we move into May, see further what has happened. Things are getting even more predictable. All right, as the control chart now, the average is 3.87, lower limit is 1.95 and 5.79. Much, much better than what we saw in the previous case. But there has been one spike. Now that spike would not have been there with the previous upper limit, but it's come as a spike now. Do we need to bother about that? You know, people start reacting to every single point. No. I mean, if it says, oh, look, it's going up, look, it's coming down. That's not the way to look at it. Look at it over a period of time. It's pretty stable. All right. Now, this is up to 5th of May. Okay, so this was for the audience last week. Well, something special for the audience this week. We're going to go further into May and see what happens. All right. When we go further, well, here it is. It's raised. The average has gone up slightly to 4.01, and the limits are little on the wider side, 6.02. But you can see it's pretty stable. Now, there have been 2 spikes. All right. And, well, I drew a control chart because I have it up to yesterday. And here you can see around the 10th of May, there's a spike. All right. And there's been a spike somewhere around, 18th or 19th of April, there's a spike. And as I drew the control chart and sent in my report yesterday, there was another spike on the 17th of May. Now my head started going wrong, because here's where the number of, oh, by the way, the number of tests being carried out is right now in India 100,000 tests per day. And the average still stands close to 4.2 or 4.3. So we are way within limits. I mean, as the average, but the limits also remain, well, at 6.3, I think, and 1.85. But that's something else. But something else that I discovered. Now, when I looked at these spikes, they were on the 10th of May and again on the 17th of May. Now, if you look at the calendar, there seems to be a pattern here. Both 10th and 17th of May were Sundays. So I said, wait a minute, there's something happening here. All right. Now, by this time, we were in the 4th phase of the lockdown. But the reason why I drew the control chart was that I wanted to show that the lockdown was working. So we had lockdown 1.0, then 2.0, and 3.0. But 3.0 was to determine what we call as containment zones. So every single state in India, they have marked out what we call as containment zones, the red, so to say, okay, the red areas, and then you have the green zones, okay? So you have the red zones where we closet them and we carry out tests separately, and the green zones where I didn't know the real percentage of tests being carried out in the red zone and the green zone. So understand why I drew the control chart. I drew the control chart to show that the lockdown was working, and it was working, all right? But by the time we came to lockdown 4.0, when they identified these zones separately, that's when I was sending my reports in to Dr. Girdhar Gyani, and I asked him that what percentage of the tests are being carried out in containment zones and non-containment zones, because now you identified them separately. And he said, I don't quite know that. I'm quite sure they're doing the sampling pretty well. But 10th and 17th were Sundays, and that's the day we had spikes. But the spikes were there because the number of tests carried out were much less. Let me give you an idea here. Up to the 10th of May, you can see it's pretty, the graph is pretty stable, predictable, right? I won't use the word stable because I'm not looking at a process here. And the average number of tests was something like 85,000. But on that Sunday, they tested only 64,000 people. And the number of cases were high as a percentage, and that's why it went way beyond the limits. After 10th of May, between 10th and 17th of May, again, the average tests were 90,000. But on that Sunday, it was 70,000. Now, if you see here, the percentage of tests being carried out on Sundays was around 25% less. And that's when I said, wait, there is something. The numbers are trying to tell me something. And both are out of control. And in those tests that are being carried out, okay, which are less, there obviously are much lesser cases being reported in those than in these. So there has to be a difference. I don't know whether the audience is really getting this, but yes, there has to be a difference. So I dug deep and I found that there were 543 test laboratories carrying out COVID-19 tests in this country, in my country. 385 were government controlled and 158 were private. Now, obviously, on a Sunday, the private test labs were, should I say, taking a holiday because the number of tests being conducted was less, and it's by 25%. You can, if you look at the percentage, it's 25%. So obviously, the government laboratories are carrying out tests in the containment zones and the private laboratories in the non-containment zones. And that's why it's spiking to 6 point. If you look at the graph, it's 6.6 or 6.7, close to 7. And the average is 4, which means hardly a percentage point in the non-containment zones, which means the lockdown actually worked. We demarcated these two areas and we are getting different results in the tests being carried out. Well, the control chart does not tell you the whole story, but it tells you there's a story to be told. You have to look for it. Now, this was phenomenal. When I came across this, I said, wow. So I'm not going to feel very bothered when I see these spikes on a Sunday, because I know that the number of tests being carried out is less, and the cases being reported in the containment areas, there will be higher incidences. That's why we call them containment zones. And in non-containment zone, now we have to carry out tests in both the areas, because in the containment zones, we need to see the speed of the spread, and in the non-containment zones, the extent of the spread. So both are important, right? So coming back here, when Dr. Gyani asked me to draw control charts for fatalities and recoveries, well, when I drew it, I was, well, how do they calculate that? We take the number of people deceased and divide it by the total number of cases for the day. So it's the cumulative cases, and then we see there is a percentage. Well, this made no sense, right? It was just going up and coming down. And how can you even control the number of fatalities? You don't even know. I mean, it's a medical kind of thing, right? Whereas there, I was trying to show that the lockdown was working because we were carrying out tests and the percentage was pretty constant. So it's pretty predictable. We can work with that. But this makes no sense. What I'm trying to say is, we don't draw control charts for anything and everything. Just because it works somewhere doesn't mean it's going to work. It makes no sense here. What are you trying to control? You're trying to control people from passing away. You can't do that. You're not God, all right? But you need to have a medical person come in, and there's so many complications here. I mean, you have comorbidities, okay? People who have multiple kind of the disease, I mean, diseases with them, and they contract this. We don't know what kind of an effect they're going to have. We're going to see the treatment that's provided to them. Were they asymptomatic when they tested positive, when they were brought into for treatment? Were they mild symptoms? How do we know? All right. So we see here, and there's one of the doctors on the news channel the other day said, I wouldn't be too bothered about the cases. I would be bothered about the people who are in the ICU, who are on a ventilator. I would want to see those cases who are critical. That for me is where I can actually work as a doctor and try to reduce the incidence. But this is for fatalities, and same with the recoveries. Now, recoveries have been phenomenal. All right. If you see that graph, okay, here you can see it's going way. What can I even say here? It makes no sense. I mean, it is going to rise because let me give a case here. Okay, it takes around 14 to 17 days to recover. So I have all of the data, right from day one. I mean, from when I started charting this, so that's around March 20th. I think I have the data. So if it takes 14 to 17 days to recover, okay, let's take the case here. Someone on March 30th, right? There were, say, 1,000 cases, which means on April 16th or 17th, I should record 1,000 recoveries, right? Now, when I say 1,000 recoveries, not all of them would make it, right? That's where I use the control chart. If you see the fatalities, the upper control limit was around 3.4%. So I took those cases, positive cases, subtracted around 3.4% from that, and then I said, okay, we're going to record so many recoveries today, max, all right? And anything on the lower side, I would subtract. I mean, I would add that much to it. On the lower side, I would subtract and say we're going to record between this and this. Believe me, I've been hitting these numbers, all right? And from May 1st till today, all right, whatever number I said, we're going to be hitting so many recoveries today, we've been hitting that. I made a statement to Dr. Gyani on the 1st of May. Starting from 2nd May onwards, we're going to record more than 1,000 recoveries every day. Well, it went up to 3,004 today. We are recording 3,000 recoveries a day. Obviously, if you're recording 3,000 cases 20 days ago, 15 days ago, we are going to record that many recoveries. And so it's going to keep going up. Right now, our recoveries stand at 40%, which means number of people recovered divided by the total number of cumulative cases tested positive till today. It's crossed 100,000 number of cases, but a recovery rate is 40%. 44,000 people have recovered. And if you want me to make a prediction based on the control chart, well, I can't say when the pandemic will really go away. Who can say that? We don't know the mind of the virus, right? I mean, the spikes, the horrible spike. But I would say, because he asked me a question, Dr. Gyani, yesterday, that what do you say would happen by the end of May? And I said that 31st of May, okay, we should have maybe 150,000 cases, but our recovery rate should be close to 50% at the rate at which we're going, which I think is a pretty good sign. I think the day the number of recoveries exceed the number of positive cases coming in, that's when I'll say that the whole thing is flattened. Of course, let me make one thing clear. Control charts, I'm not advocating control charts instead of whatever statistical model that people are using. I would say it's in addition to, right? Now, coming to the power of this particular tool, yes, we just saw it, and you can see for something as vague as COVID-19, whatever we're trying to make sense out of the data, okay, is what the control chart is telling us. Now, the basis for the control chart, because people always confuse this with statistics and saying that it's something to do with, you know, probabilities and 3 sigma and whatnot. Well, the 3 sigma was not a probabilistic limit, it was an economical measure, all right? And that's why it's so different. And here are the words of W. Edwards Deming himself. In fact, let me just give you the exact quotation as to what happened when he actually showed this, when he explained this, all right? This, of course, it's been attributed to Henry Neve. Henry Neve was quoting Deming. He was citing Deming. He cited that in his wonderful book, 12 Days to Deming. But here's what W. Edwards Deming had to say, and I'm quoting W. Edwards Deming verbatim. How can we aim for minimum economic loss? It has nothing to do with probabilities of the 2 kinds of mistakes. No, 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 not at all. What we need is an operational definition of when to look for a special cause and when not to. That is a rule which guides us when to search in order to identify and remove a special cause and when not to. It is not a matter of probability. It has nothing at all to do with how many errors we make on an average in 500 or 1,000 trials. No, no, no. It can't be done that way. We need an operational definition of when to act and which way to act. Walter Schuhart provided us with a communicable operational definition, the control chart using the 3 sigma limits. Schuhart contrived and published the rule in 1924. Nobody has done a better job since. And here, to bring it to a close, this is a diagram where he explained why it was economic. Now take a look at the x-axis. It says the separation of the control limits, and that's 3 sigma. And at 3 sigma, you can see he says there's an optimum loss, the actual loss on the y-axis. Now those who are connoisseurs in the field of quality will identify this parabola, and they will associate this with another giant in the field of quality, Dr. Genichi Taguchi. And he called it as a Taguchi loss function. In fact, he won a Deming Prize for that in the year 1962. Well, this was drawn by W. Edwards Deming in 1950. So you're seeing the origin of what this was supposed to be. He said at 3 sigma, you would have a minimum economic loss, right? Well, that's about what I had to speak of. I hope I made some sense. We tried to bring in an extra slide here. Okay, for the extra slide that was added from last week was what happened in the month of May and the spike, and well, how I discovered that there were some percentage of cases that were being tested by private labs versus the government labs. So I'll leave it to Noria, Kevin, whatever, if they're going to be taking some questions. I don't know how this is being managed. So, right.
Hi, Balaji. That was terrific. Thank you very, very much. Appreciate it.
Thank you.
We've got quite a few questions coming in. I'm not going to be able to get to all of them, but I will ask a few of them, not only through the chat, but also through email that people have sent. One of them really interesting is it says, very insightful. are there any recommended tools or apps, or is it common to build your own charts? And before you answer that, one of the things that I'll say is I believe there is one of the attendees on here is Beth Savage from PQ Systems. And PQ Systems is a software program that that is fantastic for building control charts. I know a number of companies use them, and they build all the different types of control charts that that you would use to look at something like that. So you might want to go to PQ Systems and take a look at what they have. And Balaji, I think you can maybe answer how you've done it. I know Lloyd Provost also sent some Excel spreadsheets to you to take a look at. And I saw that a recent article, I guess just recently in U.S. News and World Reports just came out using these same control charts that my grandfather advocated. So maybe you can talk a little bit about that.
Well, yes. I of course, I use Microsoft Excel, but I think I need to get Beth Savage to give me a copy of a licensed copy of her software. Yeah, I created my own template, and I've been updating the charts right in there. You also have, of course, Beth Savage PQ Systems. You have Minitab, but also, Lloyd Provost. It's good that you took his name, because when he came to know that I was using control charts for the pandemic, he said this is the best thing I've heard. But he uses some more sophisticated and much more advanced kind of a control chart with a hypergeometric curve, and I think that'd be wonderful. In fact, if you could have him and take this forward to another level, it would, because he's combined some of the statistical learning along with what W. Edwards Deming said. So like I just said, you can't have it instead of, but you have it in addition to. All right. So, and he of course used the C chart. I use the XMR because C chart is more for constant sample size, whereas here I just explained that the sample size just kept changing. So what I did was I took the percentage and I drew an XMR chart for that. So that's what I've been doing. And the only, what I could say, drawback, the XMR, you can work with max 30 points, and after that you need to go to XBAR. So what I keep doing is, since Dr. Gyani asked me for an update every week or 10 days, so I just keep changing the dates, and it's been wonderful to watch how things have been changing over these last 2.5 months. So you can see the average itself has been going up and down slightly, but overall the average still stands at around 4.2% of the cases turning positive, 4.2% max. But like I said, the limits have been changing over a period of time, and that obviously will happen, except for the one spike which I told you happened at the end of March. So yes, answering the question, there are a host of softwares available, and you could avail of them. I just use them because at that time, of course, now many of these versions are not that expensive. At the time when I got into the field of quality, giving the difference in exchange rates between my country and America, it becomes very costly for us to buy a software like that. And so I learned how to do that in Excel. So that's what I use. But I would definitely recommend it, since Beth is on here, and I have seen some of the trial versions in action. So Minitab, PQ Systems, they're really good. In fact, even I think there's another one. Jean-Marie Go told me something about this.
Yeah.
He's got something going, and we have a couple of other people. But I would definitely recommend these, yes, because in fact, they're apps also. You can just click and boom. But when I teach this in my college, okay, which of course anyone who's been my student, they know who W. Edwards Deming is. In fact, they know quality, they know this, and they know the control chart. I only keep warning them, you should know where to use the control chart, right?
Yeah.
You begin with, what am I trying to understand?
Yeah.
Is this a process I can understand? And if I can, then let me use the control chart. Don't just draw a control chart because you can draw a control chart. That's a silly thing to do.
So let me ask you this. Another question, there's some other similar ones like that, is how can you make an allowance for potentially false positives or false negatives in these tests? Is there any way to do that, or is this just going to be factored into when you're looking at the charts?
Oh dear, I wish I was on the ground actually doing this, because I'm just sitting here at home trying to figure out and being thrown the numbers at. but I would love to be at the place of action and actually collect the data myself. Then there's in fact in W. Edwards Deming's book, Some Theory of Sampling, he's also given some method of sampling in epidemics like this. So it would be, I'm quite sure they're doing something scientific about it, because you just can't take, like I just explained, you can't take the same sample in a containment zone and a non-containment zone. You will get different numbers, right?
Yeah, and Balaji, can you explain real briefly what's the difference between a containment and a non-containment zone?
Okay, in India, okay, what we've done is we've identified these areas where there have been a spurt of cases. So the lockdown helped us do that, right? It kind of created these zones where we found that there were areas where the spread of the disease was quite high. So we contained that. And there are certain, I mean, they follow a certain different kind of a routine. You're not supposed to move out of the containment zone, right? Neither are people from outside to go in, except for essentials like groceries and milk and, well, whatever, vegetables and what have you, right? And when you enter a containment zone, then you take maximum precaution, right? And when you leave, when you're not supposed to leave without special permission, and you'd be escorted to a certain place. Whereas in a non-containment zone, we do follow rules, but it's not as strict as in a containment zone. And as we see, as the number of incidences would start coming down, then the aim is to make these so-called red zones more green. So there's a website, in fact, that's been created, covidhotspots.in, where the zones have been marked out. So that's the way we manage in these differently. That's what we've done here in our country, and I think we're going the right direction. So let's see how it all pans out.
Okay, let's see here. One thing, if you can go back to slide 21, Naraya. Question, I'd like to know in slide 21, how can it affect the results with the elimination of that April 1st data?
Oh, actually, I would not. I told you, if I were doing this in a process which was manufacturing or something which I'm controlling things, or maybe with something physical, or maybe even in a service industry to a certain extent, all right, I would deal with it differently. The reason why I decided to ignore this spike, because it was a very, very special case, and I just wanted to know the effect that had on the limits and the average, and that's exactly what it showed me, that it was distinctly different. You can see that the number of percentage of positive cases was 40 on that day, right? And that's phenomenally high, right? But this was like a test for the control chart for me. Okay, I said to myself when I started plotting this data that because there have been cases where I found a point which there was a spike, but when I drew the control chart, it turned out to be within the limits. So the control chart tells you when to act and when not to act. Okay, for instance, here, when you look at that big spike, there are two spikes before that, which are going up and down and up and down. Now, if I see it without this spike, if you go to the next slide, you'll see here that it's very, very close to the upper control limit. Can you see that?
Yeah.
Right, that's around. Yeah, so that sometimes when you get data like this and you look at the data and you say, oh my God, this is really high. But when you draw the control chart, it tells you, no, it belongs to the system. It belongs to the process, right? So you don't need to really panic there, but you don't need to ask a question, what happened here? You would ask a question, what happened, only when it crosses the limits.
Yeah.
I think last time I took that example because you asked me a specific question, that I did that for rainfall in Mumbai, and and that really changed the whole game.
Yeah.
But yes, I would recommend definitely that if you're doing this for a process which you are managing, then stop the process and ask the question. This is a very special case. I mean, COVID-19, we can't control it, but we can predict it, and we can also say that it helps us. If I want to say that I'm taking some action and I want to see the effect of that, then I can do a before and an after study with the control chart. So it worked with us. So 4.67 became 4.68, yes, but the limits came down, and then of course you saw the rest of it.
Well, and it becomes one of the things, another question that's been asked, and some other people sent it in by email too, is that been reading in the news that there are a lot of delayed test results coming in from either private testing labs or public. Wouldn't that create a challenge with plotting the chart?
It would. That's why what I do is what the government of India is ICMR. If you see one of the slides, it says that's where I get my data from, Indian Council for Medical Research. And what they've started doing is they've been updating the number of tests. I think somebody's been listening to me, because now there are two counters there. So one counter is the total number of tests conducted in India till today, and the second was the number of tests conducted yesterday. So on a daily basis, they're showing two numbers. So the number of tests, the results, I think they're saying that it's instantaneous, and I have to believe that, Kevin. I mean, I told you I'd rather be on the floor doing something.
Yeah.
I mean, even I was in my place of work, I would be where the action is, because that's where you can take some kind of decision. I'm just sitting here and trying to imagine things. Can you imagine? I figured that whole damn thing about the 25% thing all by myself, all thanks to the control chart. But yeah, I mean, I would have done, if I knew this from day one, I would have drawn a separate control chart for the containment area and the non-containment area, and we're going to control that differently. Well, there's so many things you could have done, but that's the way it is.
Well, I want to be respectful of everybody's time. I did want to ask one last thing. I'm sorry we weren't able to get to everybody's questions. There's a ton of them coming in, and appreciate you asking them. I'm sorry we didn't have enough time to get to them. But one of the things that really jumps out is how critical it's going to be. I mean, the testing, what you're showing is the rate of infection while we're in a lockdown. So as we start to relax those lockdowns, this is going to become even more important in terms of saying, are the rate of infections going up, or are they remaining steady, for those policymakers and those in charge to make some decisions. So having some insight into what does this actually mean is going to be important, don't you think?
Absolutely. And that's the reason why we are not in a hurry to open up the whole damn thing. We're opening up the zones very slowly. And now the next, I think this last couple of weeks have been, that's how the insight came in, right? I could make out that difference because we opened up slightly, right? And I could see that the number of tests being carried out here was different and there was different because the incidences were high in one and not in the other. And this came out through that Sunday thing, and I hope you're all putting it all together. But I think it is going to be imperative that we do continue doing this, and that's why Dr. Gyani continues to ask me for my reports.
Terrific.
Yeah.
Go ahead.
No, I just said I don't know whether they're. I can't really tell whether whether the Prime Minister has actually looked at the graph of mine, and I don't even care right now because they're taking some action based on that. And I can see some of the media is using the language that I'm using. The percentage of positive tests is so much. I said till around a month back, they were just saying the number of tests is so much. So I'm quite sure that there's something happening, but I don't have evidence to say that it's because of this. Definitely.
Well, thank you very, very much. There's been some tremendously kind comments that we'll pass along to you from some of your students and from other people. And we really, on behalf of the Institute, deeply appreciate you taking the time. I know it's late there in India to get on with us, explain this, and hopefully those out there in the audience can use this as an impetus to create some level of awareness within your own communities and how everybody's looking at this and reacting to it rather than reacting to data point 1 and 2. It's either up or down or vice versa, and say we need to look at the bigger picture and make some decisions based on that. So thank you so very much, Balaji. Deeply appreciate it, and pleased to have you on. Nuray, I'll turn it back over to you.
I'd just say something before Nuray takes over. Really want to thank you, Kevin, for helping me reach out to so many people and giving me this opportunity to be a part of the first ever webinars conducted by the W. Edwards Deming Institute. It's been an honor. It's a privilege, an honor, and I hope that this is the beginning that we go beyond this. Sorry,
Thank you very much.
Yes, and on behalf of the entire Deming Institute, I'd like to thank everyone who joined us today. We know some of you are joining us from time zones where it's pretty late in the evening, so we'll let you get to bed. But please do not hesitate to reach out to us via email, phone, social media, and we hope you consider spending just a couple of minutes filling out the survey that will pop up on your screen as soon as we end the weekend and the webinar. So have a wonderful weekend and stay safe. And thank you for joining us. Thank you, Balaji. Thank you, Kevin.
Thank you.
Thank you. Appreciate it.
Bye.
Bye.
Bye-bye.